A brain condition has threatened to rob fans of Hollywood's most die-hard action hero. Bruce Willis announced yesterday that he is stepping away from acting after he was diagnosed with a life-changing communication disorder known as aphasia. To help us understand more about this condition, Dr. Scott Dellorso, a vascular neurologist with Baptist Health, joins us, and he's going to help us take a deeper look at this condition. First of all, so many people, Doc, are just upset to hear about this diagnosis.
I know. It's obviously a lot of people really love Bruce Willis, and it's hard to hear that he's having to step away as a result.
So someone who develops this, aphasia, what effects can they expect and how does it progress?
So aphasia is an impairment of language. It makes it hard for people to speak, to understand, or to even read sometimes. And that impact can vary depending on what people do, but obviously it makes it really hard for them to be the person they were, work, and interact with friends, family, and everything that they do using that.
Mm-hmm. And what are some of the things in particular that may trigger or cause this illness?
Sure. Well, the most common cause of aphasia is a stroke. So that tends to occur pretty rapidly, but there are other causes as well. Could range from seizures, a tumor, or even a type of dementia that rapidly affects sort of how you are able to speak.
Mm-hmm. And this isn't something that we talk about a lot. It's not something we hear about a lot. I want to ask, is this rare, or how often does it happen?
It happens pretty commonly with stroke. The other entities that can result in aphasia are a little more rare. But when it happens abruptly, it's a pretty good warning sign that someone may be suffering from a stroke, and it can be somewhat common in that case.
Mm-hmm. Obviously, many people are worried about this, and it's a wake-up call and raising awareness about this. Is there anything that people can do to reduce their risk, or is there somewhat of an anomaly here?
I think, with stroke being the most common cause, things people can do to reduce their risk of stroke would be my main recommendation. Those would be like controlling your blood pressure, your blood sugar, your cholesterol, making sure that you're following up with your primary care doctor, eating a healthy diet, and regular exercise.
And while we've got you here, you're a neurologist, you've done a lot of research. Are there more brain-related conditions that people should know about and be proactive for?
There's a whole host of, conditions that, I see in clinic and in the hospital. But, I think the one that we really are trying to increase our outreach in the community would be for stroke. We have an acronym for people to recognize signs of stroke. It's called BFAST, where the B stands for balance, E stands for eyes, F stands for face, A stands for arm, S stands for speech, so aphasia like we're speaking about, and then the T stands for time, which means go to the ER.
Certainly some very important information. We appreciate you joining us this morning. Dr. Scott Dellorso, breaking down aphasia. Certainly, we wish the best for Bruce Willis, his family.
Absolutely. Thanks for having me.